Okay, we've done the cervical spine, we've done the shoulder, and now we're going to go to the elbow. There's a good number of muscles that cross their wrist flexors and extensors that cross the elbow, so we're going to test out elbow or wrist flexion extension. Again, Fatty's side, that's the problem side, is the left side. We're going to test the right side out. So what I'm going to have Fatty do is to bring his hand up and do full flexion of the elbow, and right there I'm going to do overpressure. Again, getting a sense of feel of end feel. The end feel here is tissue approximation and extension for me. And I do another overpressure. And the overpressure here, by the way, is bone to bone. Okay? Now I've done that. Now can you do pronation for me? Okay? And I do overpressure here to get a sense of feel there, and supination. And I do overpressure here. And again, I think what I'm going to also do is have Fatty come back to center here. Could you do wrist flexion for me? Good. And I'm going to do overpressure here because I'm going to test out the flexion extension muscles with resisted. And could you do extension for me? Good. And I'm going to do overpressure here, getting a sense in that area as well. Because what I'm going to do, overpressure stretches muscles and also stresses the joints. And since these muscles cross that joint, they cross the elbow and they cross the wrist, that's why I'm doing overpressure here. Often you will test the elbow and wrist together. I'm just kind of breaking it up a little bit, okay? So we've done active range of motion, and then I've done overpressure right afterwards. And now it's time to do some resisted testing. So Fatty, could you have you laying down, please? Now you can do this, you can do resisted with a client sitting on the table. I prefer to have them laying down for more stability, but it is a choice, and it depends on the person you're working with. If it's somebody muscular like Fatty here, I want them laying down because it's much easier to control the movement. Okay, so we're going to test out the bicep here. I'm going to pull on the forearm down, and I'm going to again ask Fatty to resist my movement or don't let me move me. Okay, and 1, 2, 3, 4, 5, and relax. And 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And it's very strong there, very good. There's no shaking or tremoring or discomfort. And I'm going to push in this direction and resist my movement. 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. Okay, so we've done elbow flexion extension. Now we're going to do supination and pronation. Okay, and I'm just going to put your arm down here, Fatty. And what I want you to do, I'm going to try to move your hand and arm into supination. Okay, and if you were a client and didn't understand what I was talking about, I would say I'm going to try to move your arm in this direction. Just resist my movement. Okay, you ready? 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And 1, 2, 3, 4, 5, and relax. Okay, so we're resisting supination. Now we're going to do pronation. Okay, let your hand relax in neutral. Okay, and resist my movement. 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. Okay, the last muscles we're going to test are wrist flexion extension. Because most of those muscles cross the elbow, I want to clear them and test them as well. Remember what I said, that often if you do the elbow, you do the wrist as well. But I'm going to test the wrist more thoroughly in the next video, okay? But we're going to do wrist flexion extension again. So Fatty, I'm going to bring your hand down here, and I'm going to try to move your hand in this direction. Resist my movement, okay? Ready? 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. Okay, so we want to go the opposite direction, which is into, I'm going to have him resist flexion. Ready? 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. Okay, good. So what I'm going to do now is joint play of the elbow, and there's a couple different joint play directions you can go. If you want to do some palpation intermixed with the joint play, that's fine. I'm going to do joint play first and then do some palpation. So what I want to do first, and you'll see it in the Merle's guide done in this format, but I find that the technique often pulls the shoulder a little bit. So what I do is I stabilize the shoulder. I let the hand drop into my into my elbow region. And then I'm going to do a distraction of the humeral ulnar joint. And just a quick distraction, testing out the movement of the elbow, testing out any kinds of discomfort. And I do that 3 times. That's okay? Good. And the next one I'm going to do is a proximal radial head, anterior and posterior glide. And I'm just going to grab the stool here and bring it around here and sit down. And I find the head of the radius. And I'm going to apply an anterior glide and looking for any kind of facial expressions from fatty that is showing as though it's painful and uncomfortable or irritated. And I'm going to do a posterior. I'm going to grab inside, locate the area with my thumb, and pull in a posterior direction. Okay, good. Now I've tested those 2 areas out. I'm going to palpate the wrist extensors. And often you'll have something called tennis elbow or golfer's elbow that you'll get on the lateral side of the forearm. I'm testing these muscles and see if there's any referral patterns, any kind of lesions, any kind of irritation, testing out the tissue. And I'm going to go to the other side, the inside of the arm, and the medial side of the arm, test out the common wrist flexors, and come in through here. Looking for lesions, looking for myofascial trigger points, areas of pain or discomfort, irritation. Okay, good. So now, go to Blackboard if you're not there already and answer the questions. Thank you.